Hi, I'm Nat from PACOP. Today on Clinical Bites, we are looking at the SAS for care workers and the symptom of distress from breathing. The Symptom Assessment Scale, or the SAS, is one of the assessment tools we use in PACOP. We have a number of resources to help you get the right SAS scores from residents, and these include the SAS ruler that you can see on screen. We have the SAS sheet where you record the scores, and we also have an information sheet for residents entitled "Your Symptoms Are Important to Us." That is a great thing to give to residents when we start collecting the SAS scores from them, and they can read about it and understand why we are asking about these symptoms every day. The thing to remember with the SAS is what we are trying to rate is the distress in relation to the symptom. So for this symptom, which is problems from breathing, we're trying to rate any distress, or we can ask them how much it bothers them, or anything anxiety they have in relation to their breathing problems. And the best way to find out information for SAS scores is to have a chat. Talk to the resident. A good time to talk to them about this would be in the morning when you're getting them ready for the day, maybe when you're getting them dressed or when you're showering them, or walking them down to breakfast. If they appear to be short of breath in any way doing any of these activities, that is the perfect time for you to be able to say, I notice you are a bit of short of breath. I notice you have a bit of problem with your breathing. How much does that worry you? Does that distress you? Does that bother you? And that is a great way to get accurate information about this symptom from the resident. If the resident can't tell you, you can rate it for them, and this is called proxy scoring. Proxy scoring is when someone else rates something on behalf of the resident. So if a resident is not able to communicate or tell you themselves, you can score it as a proxy scorer. For you to do this, you need to be able to mark down the distress level score that you think the resident would tell you if they could tell you. If there are family or friends of the resident around at the time, you can discuss that with them and ask them what they think the level of distress would be for the resident in relation to this symptom. Or of course, you can ask any of your co-workers their opinion, and you can have a chat about how much distress you think the resident experiences from having problems with their breathing. Having problems with breathing is of course very anxiety inducing for anybody, and it can also show as being restless, being distressed, not wanting to move around, not wanting to talk. They may have trouble finishing a sentence. All those things are really good clues for you when you are scoring by proxy to work out the level of distress this resident is experiencing. Finally, once you have this information, we use the 3 R's. First of all, record the score. Then look at the ruler and work out how quickly you need to report this information back to the nurse. So if there is no distress or it is absent, you don't need to report it, of course. If there is mild distress in relation to this symptom, you should report it to the nurse within the shift. If there is any moderate score in relation to this symptom, you should report to the nurse within 30 minutes. And of course, if there is any severe distress scores in relation to this symptom, you should report this to the nurse straight away. And by doing this, the nurse is able to use this information to act on it straight away to help the resident. Thanks for watching this PACOP Clinical Bite. Please watch all the others in relation to the other symptoms and problems that we record in the SAS.